difficulty and the blockages will grow, the angina will grow, and one day you may get a heart attack. Now at this moment let me explain what is a heart attack and how the heart attack happens. As I told you, the blockages, if they keep on growing, one day the membrane is there on top of the blockage. Do you remember the membrane? If the blockages keep on growing, the internal membrane will stretch and stretch and stretch, and one day the membrane will burst. Look at this slide. This is a blockage of 20%, this is 40%, this is 60%, and the blockages are growing, the membrane is getting stretched, and one day the membrane will burst, and the moment the membrane bursts, there will be chemical coming from the blockage to the middle, and in the middle there is a blood flowing, and that blood will clot, and that clotting will make it 100% immediately. The blockage immediately within 2 minutes can become 100%, and this is called a heart attack. Now at this moment you must remember, if the blockages keep on growing, the heart attack will one day happen. But at what occasion, at what time the heart attack will happen depends on the strength of this membrane. I have seen people who have 80-90 blockage and they say, sir, I have never had a heart attack. That means what? The membrane has not broken. That means the membrane is strong. So people may have 90 blockage, the membrane may not burst. And there are people who at 50 or 60 blockage, when they do not know they have a heart problem, the membrane has bursted and created a heart attack by forming a clot, and 60 has jumped to 100. Now such people are there who say, sir, I was never a heart patient and I got a heart attack. Look, they did not have blockages more than 70, so symptoms were not there, and they were thinking there was no blockage, but 60 blockage was there and the membrane was not so strong, and the membrane bursted at 60 and created a 100% blockage. A clot has formed, and the clot has created a 100% blockage. So remember, heart attack may happen after the blockage of 50%. It has been in fact seen, half of the people who get heart attack have less than 70 blockage. That means they will never know that they have had a heart problem and they got a heart attack on this one fine morning. And there are about 50% of the people who have more than 70, 80, 90 blockage. They have angina, they have heart problem, everybody knows about them, and they keep on growing, and one day the membrane will burst. So heart attack will happen when the membrane bursts. Now what is Saul doing? What we recommend to the heart patient? And think of your common sense. Common sense says that if the heart attack is to be prevented, what can be done? Let me explain what can be done if we want to prevent a heart attack. Look at this slide. The blockage is growing and the blockage is growing, and the blockages grow, one day the membrane will burst. Now if we can stop the growth of the blockage, then the membrane will not burst. Think of a small example. There is a bundle of notes with a rubber band on it, and I put every day few notes into the rubber band. One day the rubber band will burst, and this is what happens. Now suppose we don't want the rubber band to burst, then what to do? Then we should not put notes into the rubber band. That means don't grow the blockage, and better would be you start withdrawing some blockage from the membrane, and the membrane will gradually become lax and it will never burst. That means from the bundle of notes you have to start removing notes, and this is what is called reversal of heart disease, and this is what I advise to a heart patient. So we must not grow the blockage, and we must grow the blockage down. And if we know what are the causes, and if we can take care of the causes, then the blockage will never grow and they will reverse. And this reversal is a complete cure. I must tell you, Dr. Dean Ornish in United States have shown very conclusively with all the angiographies that the blockages can be reversed back, and we have already got hundreds and thousands of patients who have reversed these blockages, and I am going to explain to you how the reversal is going to happen. So if you have understood heart disease by now, the tubes are there, the 3 tubes are there in the heart, and these 3 tubes, they have cholesterol deposits. These deposits gradually grow over the years, and one day they cross 80%, people start getting trouble, and one day it may burst, it may create a heart attack, and that time the person will get angina at rest. And angina at rest with lot of sweating and severe pain, it is a heart attack. Now have you heard of a heart attack called a mild heart attack and a major heart attack and a massive heart attack? Let me explain what is a mild heart attack, what is a major heart attack, and what is a massive minor heart attack. Now let's see what is a minor heart attack first. Look at this slide. there are blockages in these tubes, and these 3 tubes I am going to show you. These are the 3 tubes. You can see the RCA, the LAD, the LCX. Suppose there is a blockage over here and this blockages grow and grow and grow and the membrane bursts. Then the area dead will be this much. This is the minor heart attack. Now if the blockage is over here and it creates a heart attack, 100% blockage, then this area will die. This is called a major heart attack. The patient may survive, may not survive depending on the treatment received. And if the blockage is at this point, 100% blockage at the left main will immediately kill the patient. The person will not get time to even revive. Now this is called a massive heart attack. Now tell me, which heart attack is allowed? None of them. Remember, no heart attack is allowed. That means what you need to do, you have to reduce the cholesterol, you have to reduce the triglyceride, and I am going to explain in the later chapter how with lifestyle change we can reduce this cholesterol, triglyceride, blood pressure, sugar, and all the reasons. If you can remove, then you don't grow the blockage, that the heart attack will never happen. And this is what is heart problems understanding, and if you have this understanding, then you will automatically know that doctor, I have to take care of myself, and let's see what we can do with lifestyle change in the later chapter. Welcome back again. Now you have by now understood what is heart problem, you have understood what is angina, you have understood what is a heart attack. I believe you have now understood the heart disease very clearly. Now the next chapter I am going to tell you is how the hospital system is going to treat heart disease. Most of the hospitals, as you know, they are equipped with bypass surgery, angioplasty. These 2 treatments definitely we do not recommend people unless it is 100% sure that there is no other option. But I believe 95% of these bypass surgeries, angioplastics can be avoided, and I am going to tell you why and how these people, they create a panic. There is no logic behind these 2 operations, but they are mostly using panic to create a scare that if you do not go for a bypass, there will be a problem. I am going to explain to you how the hospital system works on heart patients and how the operations are being made mandatory for all the heart patients reporting to the hospitals. I, as a founder of Saul Heart Program, believe that these patients better be treated with lifestyle change and not operations. So let's understand what is bypass, what is angioplasty, and what are the faults of these 2 operations. Let's understand what the hospital is going to do about the heart patient. Suppose a normal person is there eating lot of bad food, no exercise, smoking cigarette, he is overweight, he does not bother, and till 50 years of age he has no symptoms. So he tells everybody, look, I am eating everything, I have no problem, don't bother about me. But then the blockage was growing till 70 blockage, as I told you, he will never know about heart problem. But then he is very happy, he says, I am eating everything, I have no problem. Then gradually, few months back, he finds out that whenever he is walking and climbing, he is getting some chest pain on the left side. That means what? The blockage has already crossed 80%. Now he does not tell this to anybody. He says, okay, this may be a gastric problem, this may be a breathlessness because I had some infection. But then gradually every day he walks, he climbs, he gets that same pain. So he understands that there is some problem, but he does not tell it to the family member because he believes that if he tells them, the wife will be very worried and the son will have to leave his work and he has to be with me and I have got a heart problem. So he does not tell anybody, he just carries on. About a year he carries on. Whenever there is a climbing involved, he says, I don't want to go. Whenever there is a walking involved, he says, I am busy, and he carries on somehow, and he has no symptoms because he does not walk now. But one day, every family member were all walking and the husband is falling apart. The wife says, why didn't you walk fast? Now the husband says, if I walk, I get a chest pain. Now wife catches up, there is something wrong, let's go to a cardiologist, let's go to a local cardiologist. So they now reach a local cardiologist and explain to the doctor that, sir, if I walk, if I climb, I get a chest pain and this pain is going to the left arm. Now the cardiologist immediately can make out that it is a heart problem. You can also make out. Now the blockage is already 80%. Now the cardiologist does the ECG, ECG is normal. So cardiologist says there is no problem in the ECG, Patient says, sir, ECG will not show. You take the ECG while I am walking, then the pain will be coming and then the ECG will show a change. Right? This is called the treadmill test. You must have heard of an old test previously used to do for heart patients. What is that? That you put the ECG, ask the patient to walk slowly and then fast and then run. And if he can run, that means 30% is available. And if he cannot run, if he cannot walk, and before that the angina comes or the ECG shows change, this means it is TMT positive. So the cardiologist agrees, okay, let's do a treadmill test or exercise stress test. So the patient is put on the machine, he is standing on the machine, they put the ECG and they want them to walk. And the patient walks little and the pain comes and the doctor says stop the machine. Now the declaration is TMT positive. So the cardiologist tells the patient, you are a heart patient. Now the patient family is very worried, sir, then what to do? Cardiology says, I have already written the medicines, you take these medicines. Now the patient wants to know, sir, further what to do? Now the cardiologist knows, if I have to explain about the food and exercise, I don't have time. And during this time also I can see few patients. So he is not interested to tell about lifestyle change. But then he suddenly remembers the heart hospitals, they are also inviting patients from him. So he says, okay, do one thing, you go to this heart hospital, and he writes the name of the cardiologist, that you take this slip, go to a cardiologist, to the heart hospital and go for an angiography, and after angiography, if they say bypass surgery, angioplasty, you do any of them, whatever the doctor wants. Now the patient is not happy. He says, sir, no bypass, no angioplasty. He says, sir, anything else I can do on the diet and all. Cardiologist is not interested to tell all that. He says, look, you do one thing, you go and tell the doctor that I am the cardiologist who has recommended him to go to the surgery. This obviously means there is a kickback coming. But nevertheless, don't worry about that kickback. You reach a heart hospital next day, but you don't want a surgery. The psychology is no surgery, no angioplasty. You reach a heart hospital, meet the cardiologist for a second opinion. Now, after you tell the cardiologist, sir, I walk, I get a chest pain. If I stop, the pain goes. He immediately knows that one more patient has arrived and I have to take appropriate action. By that time, you also saw your treadmill test. He knows definitely the blockage is already more than 80%. But now he does a mischief. What he says? He says, look, I don't know, there may be blockage, there may not be blockage. Now the patient is suddenly happy. That means there is a chance of not having any blockage. Cardiologist says, yes, it may be there. Only if you do a small test, we will know if the blockage is there or no. Patient says, sir, any test, I am ready. You do whatever test. Now the cardiology obviously says, we go for an angiography. Patient says, sir, any angiography, any graphy, I am ready. Now the doctor says you have to get admitted and we put a wire inside your body, and this wire will direct us to the blockage and we will know how much blockage is there. So we have to get admitted, you have to pay 15,000 rupees, and during this wire pushing, if you have any trouble, you have to write a sign, a bond that if I die, I am not, the doctor will not be responsible. Now the patient is still worried. He says, sir, I don't want to do the test. Is there any test from outside we can know the blockage? Cardiologist now tells another lie. He says there is no such test. Only angiography is the test through which we can know the blockage. Now what to do? Patient immediately thinks that, look, if I go back home, again the pain comes, then I have to again come back. So let's do a test. He is not looking for an operation. He says, okay, only an angiography, no. Sir, will you tell me the blockage? Doctor promises that tomorrow after the angiography you will know the blockage and then you can decide what to do. Now the patient will agree or not? Yes, he agrees. He says, okay, let's go for an angiography. And what he is thinking? The patient, is he thinking he will have blockage? Patient thinks there will be blockage because his lifestyle was bad. So he says maybe 30-40 blockage will be there, and immediately plans, as soon as the angiography is over, I will go back home and I will change my lifestyle. I will eat right food, I will stop smoking, I will walk. All these he has planned. So he says, okay, let's go for an angiography only as a diagnosis. Now what the doctor is thinking, think of the doctor's mind. He says, I know the blockage is there. Let him first get admitted and get into my my system, and then I will tell him what to do. Now the angiography is done. The doctor has to push the wire. You can see an angiography slide in this. They have to put the wire from here, and the wire has to go till the top, and once the wire will scratch all over. Remember, this angiography has a problem, it scratches all over. It can also create a puncture inside. But the doctor says it's a small thing, only you have to write a bond that anything happens, we are not responsible. It's a very small test. Now this angiography will show the blockage, and once the angiography is done, the blockage will be told as 70 and 80 and 90. Now do you think it is a very accurate test? If the blockage was accurate, they should have told 71.5 blockage, 83.9 blockage. But the cardiologists, they know very well this angiography is a rough angiography. So they give you a report as 70, 80 and 90, all round figures. And these figures will also vary from cardiologist to cardiologist. In Delhi, one patient came to me, he said, sir, yesterday only I have reversed 10% blockage. I said, how did you do that? He said, no, one hospital I went, they said 80, another hospital I went, they said only 70. I said, how are you feeling? He said, I am feeling much better now. But remember, this angiography is not a very accurate reading. Now the cardiologist, based on that same angiography, now comes to the patient and tells, I am very surprised that you are still alive. Now the patient says, sir, but give me the report, I will go home. No, this is a very critical blockage, you can die any moment. It is a very good luck that you could reach here. No chance, you can't go out. Now suddenly the patient says, sir, what has happened? Yesterday the blockage was there, today the blockage is there. Cardiologist says, no, any moment you may die. You are carrying an atom bomb. Anytime it can burst. Now suddenly the patient is upset. He says, sir, what happened? Now, will he be scared or not? Yes, he will be scared. The cardiologist makes sure that he is scared. All the panic has to be created now. He says, look, any time it can burst. Now, does he know when the membrane will burst? Think of it, 70, 80 and 90. The blockages are not very clear, 10% plus minus they don't know. But they know only one thing, that the membrane will burst today and before you reach the home. But now the patient has to immediately decide that, yes sir, I want to go for a surgery or go for an angioplasty or not. Now cardiologist puts a pressure. Patient says, sir, look, one thing you must tell me. You told me you will do the test and let me go home. But now you are telling I can't go home. But yesterday I had come walking. Doctor says, no, dude, you can't walk. I don't know. It's a wonder that you could walk and come to the hospital. You should have been dead by now. The patient says, sir, but I was all right till yesterday. No, now you are not all right. Patient says, I am all right, you discharge. Now the doctor is very angry. He says, you lie down. I will talk to your relatives. So the patient lies down, he goes to the relatives, and who are these people waiting outside? The wife, the children, and by that time they have called all the uncles and aunties and all the friends and relatives, and all are there. So the cardiologist has to go over there outside the operation theatre and tell the patient's relative, very critical, any moment he may die. Tell me whether I should operate or I should not. Now what is the answer you think the wife will give? She starts crying. She says, don't wait, you immediately do the operation. The son will say, whole of my life I have only taken from him. Let me give him little back. So the son agrees also, okay, let's go for an operation. And the operation is usually done. 99 out of 100, mostly operations are agreed upon. One patient told me, sir, exactly this happened to me. I said, then what did you do? He said, sir, I agreed because I did not want to go for operation, but my family, they pressured me like anything and I had to do an operation. One patient told me also, sir, I still did not go. I said, how did you manage? He said, sir, I told that doctor that, look, I don't want to do it. They said, no, you can't, you have to do it. You can't reach home. He said, I will reach home. They said, you write a bond. So I said, okay, I'll sign the bond, you give me the bond. So I wrote the bond. Still they were not discharging me. Then I used the last thing. What is the last thing? I told them that, look, I don't have money. Without money you want to operate, please operate. Then the doctor says, okay, then you can go home. There is no problem now. Then when I started, I said, give me the discharge, I don't have money. So they had to discharge me. They gave me a discharge summary and I was packing. Then the doctor called me again. that before going you come and see me. So when I went there, they said, look, 2.5 lakh, if you don't have, give me 2 lakhs, I will operate. I said, sir, no money at all. Then they said, okay, how long it will take to get you the money? Then I said, okay, I will take about 2 months. Then they said, okay, after 2 months the heart attack will take place, don't worry, you come back after 2 months, we will wait till 2 months. Now, have you understood the meaning? That the heart attack, when the heart attack will take place, the doctor does not know. But he wants to create panic by telling that today the heart attack will take place. And this is how most of these bypass surgeries or angioplasties are done. I don't know whether you have some experience, but if you want to be having an experience, just visit a heart hospital and see how the relatives are told, and you will find almost similar. I do not want to blame a particular hospital. Most of the hospitals and most of the doctors in the heart hospitals, they have the same attitude towards patient. They don't want to explain that the blockages should not grow, and they do not know when the heart attack will take place, but they scare like anything. But instead of this, they should have told the heart patient that, look, your cholesterol is high, your triglyceride is high, smoking habit is bad. If you keep on growing, then one day the membrane will burst and a heart attack may take place. So please change your lifestyle. Often the son of the patient, they ask, sir, if the cholesterol is high, can we reduce it? Can we ask him to stop smoking? Cardiologist says, look, there is no time to wait. He is dying and you are gossiping. So let's do an operation immediately. So this is how most of the operations are done. Anyway, I am against operations. And why? Let me explain.